Welcome back. Today here at noon we are talking with Dr. Carolina Qsorio. She's with geriatric psychiatry here at the Loma University Medical Center. We're talking about geriatric mental health and some symptoms that as people age, they get older, things start happening sometimes that can be treated. It's not just about getting old. We were talking before we started talking about some of the symptoms people might notice with their moms, their dads.
Sure. Yeah, so as we age and our loved ones are aging, there are going to be some changes that naturally will occur.
Yeah.
So for example, people will have tip of the mouth difficulty finding words or misplacing things, and that is normal. However, if you suffer from chronic memory loss, that's something that is telling us there's something abnormal and potentially serious. The same thing is going to happen with depression and anxiety. You know, if you lose someone or you're having a lot of stressors, it is okay to feel sadness, a little bit anxiety. But when you have depression for 2 weeks or longer, then that is really something we have to be serious about and take care of.
You said sometimes it's just the inability to do some of the thinking processes, the finances, paying the bills. What are some other things that might tip off a child that their parents may be having some mental health issues?
Right. So in our older population, mental health presents a little bit differently than in the just general adult population. You're going to have this person who is losing weight, having either sleeping too much or not sleeping at all. They're having trouble handling their finances. They're not keeping up with their chores at home. They're losing interest in the things they used to enjoy in the past. And they are having a lot of physical complaints. They have been many times at their primary doctor and anything seems to be normal.
And the doctor says everything's just fine.
Right, yeah.
And then, but you know there's something going on.
There is something else going on.
What treatments are available for people? I'm told much of this in fact is covered by most insurance programs too.
Right, yeah, so there is a big push on the coverage of mental health issues.
Yeah.
And we want our older population to be really geared to a healthy aging track. And so in our facility we have different levels of care. We have inpatient for geriatrics, which is really mainly for people who are in crisis. And then we have an outpatient daily program in which the person will come 3 times a week, every day for 3 hours.
Okay.
And it's called the Wisdom Program, and it's geared towards a healthy aging in our older adults that are having some of these symptoms that are related to depression and anxiety and the stress of a lot of life events happening.
So you don't just have to sit there and say, there's nothing I can do. You can make a phone call and try to find out more about this. And there's assessments that are available, free assessments, I'm told? That
yes, they're free assessments. You give us a call, we'll bring you in, we'll make a full assessment. We have all different kinds of specialty trained people that will help with this. And then depending on the symptoms and what's going on, then we'll make our recommendations.
Great, that's interesting. It's good information to share. There's so many people out there that might be helped by this.
Absolutely, yeah.
Dr. Qsorio, we appreciate your time. If you want to find out more, you can give a call to the Loma University Behavioral Medicine Center, 909-558-9275, or llubm.com as well. Thank you so much. We appreciate you being here today.
Absolutely, no problem.
The Deserts News Leader continues. Stay tuned.